Good morning, Ed. I'm getting back to you about your pitch deck, and I have some additional insights for you based on my mind map. So please pull up the mind map on my email, and I'm going to walk you through the circles so that you understand kind of what I'm thinking about. Excuse my terrible handwriting. Since I'm a doc, I'm entitled to crappy handwriting, and I'm taking full advantage of that. First, in the middle circle is CHWC, which stands for Community Health and Wellness Centers, and it's basically the big vision component that I would like to add on to your concept, because I think it'll help you raise more money, and it's going to make your pitch more interesting to investors. As I've said a couple of times, I've tried to help companies raise small amounts of money, like $3-4 million for my buddies at Microbic Block, and investors were kind of they basically said, "Look, this deal is too little for me. It's just as much work to raise." Put together a package to raise $100 million as it is to raise, $5 million. So why would I do a $5 million deal? Okay, well, okay, I get it. It's about the money. So I'm pitching you a concept that's going to allow you to raise more than $10 million. And I don't have like I said, I'm not a numbers guy, so you're going to have to put the numbers to this. But here's the concept. One is I really like your approach. I agree with everything you said about the shortage of primary care physicians. The numbers are basically at least 40% of all patients come in with physical complaints, but they're driven mostly by depression and anxiety. And so if you can cut off the depression and anxiety people from the real serious physical issues, you can bifurcate your practice into a smaller group of people who actually need to see a physician. And so I'm going to advocate to you that in addition to your one primary care doc and 2 PAs, that you add a mental health counselor with cognitive behavior therapy training, which is the best research-based treatment for depression and anxiety. It's over 80%, 80 to 90% effective in highly trained CBT therapists. And so that's another way for you to keep people from a long wait, because you can cut down the number of people who actually come in. And some of these people can be screened via the phone or an app to keep them from having to come to the clinic to be treated. Telehealth for CBT works for a number of people, not all people, but some people need to have a live body and to help. But for a lot of people, an online visit with a shrink like this would be just as effective if the shrink is a trained cognitive behavior therapy person and can screen out the depression and can treat the depression and anxiety people and keep them from using an office visit and take up physician time. So that's part one. So starting at the top, because I think you want to focus on health and wellness and well-being, I want to change the name of your company from Quality MD, which is a sickness-focused name, to Community Health and Wellness Centers, with the idea being that you're going to promote a positive outlook on health and wellness and not a focus on diagnoses and illness. So that's part one. Part two is I think there's an opportunity to do a multi-level subscription service, which would allow you to do concierge services for people who are willing to pay for concierge services, with a tiered, more affordable system focused on people who rely on third-party payers. And so I would encourage you to consider that as an alternative way to fund your business. Let's see, next. I'm going counterclockwise. So the next bubble says user-friendly office design. As a part of my checkered career history, when I was at Texas Instruments, we did a lot of work with a strategic design firm called the Doblin Group in Chicago. And that time was incredibly educationally interesting and helpful to me because their deal was user-centered design. And they had worked with IDEO Design, which is the design firm that does a lot of Apple products. But IDEO and Doblin Group focused on user-centered design, and their focus was on using video as a way to discover what the user experience was and not use what the user says, because people don't really know what they're doing. They just know what they think. And so it was a kind of eye-opening experience for me, because it became very clear that most of the time designers design in response to market surveys, not in response to what people actually do in the environments or with the products that they are buying. And so my experience as a patient has been medical office design is awful. It's just awful. Big waiting rooms with 50, 100 people waiting to see a doc. And as you know, docs are never on time, and so wait times are always long. So people are sitting in the middle of this big waiting room with other sick people, and they don't have anything to do. And so some of them are on their phones, but the environment is unfriendly. It's cold, it's impersonal. The nurse comes out and yells people's names to see the doc. And so it's just not a friendly environment. And there's a lot of research that says that that people who are in environments that have lots of plants and water sounds and pictures of nature get better faster. In fact, people in the hospital stays are decreased by 2 or 3 days just by having somebody be able to see out the window and see a tree. And so I'm encouraging you to rethink the office design so that it's user-friendly. It's got a lot of nature, smells, sounds, lots of visuals of trees, lakes, waterfalls, and small and friendly, so that and more like a hotel lobby than a doctor's office. There's always a barrier between the patients and the people in the back, and that's very unfriendly, and it's not necessary. I mean, all you need is a desk. And so for a lot of these doctor's offices, having somebody who's warm and friendly at a desk, so when you walk in the door and you're going to make your appointment or find out when your appointment is, there's no need for sliding glass windows and all the crap that goes on in normal doctor's offices. So making the environment friendly and encouraging is an opportunity for you to distinguish yourself from traditional medical offices. That's all I'm saying. And the emphasis is on trees and water and nature and all that sort of stuff. It will, for a lot of these people who are depressed and anxious and have white coat terror, being in a place that's more like a hotel lobby or a spa lobby that's soothing and warm and friendly will decrease people's irritability and anxiety when they're coming to see a doc. As a part of the big concept, I think you should put your offices affiliated with a fitness center. And my concept for this would be that rather than building an MOE for your practice, that what you would do is you would buy a defunct fitness center, use 10,000 square feet of that space as you outlined in your business plan for your offices, and use the fitness center as a way to demedicalize your practice, the practice. So people could come in to use the fitness center. Your docs could encourage people to become part of the fitness center. Subscription to the doc's practice could include the fitness center, and that way it would, like I said, demedicalize the whole process and focus on health and wellness, not on sickness. The other thing is financially, this could turn the whole enterprise, it with a real estate play, and decrease your initial office costs, since you don't have to build a building. You're going to remodel a fitness center and part of a fitness center, and use the revenue from the fitness center as well as the revenue from the practice to drive the business. Okay, next circle around is AI managed ops and billing and scheduling. I don't know if you have been using AI yourself, but I have been for the last few months kind of experimenting with it, and I've been using it to do research and to help me write. I've got some projects I'm working on, but I have seen I'm reading a lot of stuff about how useful AI can be in automating repetitive tasks like billing and scheduling, and I'm sure dealing with insurance companies. And so and AI is hot. And so if you have an AI component, that's going to make the whole pitch a little bit more interesting to people who are tuned in to what's going on with AI these days. And so, and I think it will increase the efficiency of your business and drive down your people costs as well. So if you're not using AI to do your billing and scheduling, this would be an opportunity to do that. Next thing around on the very bottom of the mind map is Community Health and Wellness Center app for telehealth and electronic medical records. I think that driving out the intake process to a smartphone would allow people to do their sign-ins and do their initial complaints and provide you with their medical records via an app that you would develop and download to your members, and that would allow you to screen out some of these depression and anxiety people before they ever get to the office. And it would also allow you to identify the cold and flu people and the COVID people before they arrive at the office, and allow you to direct them to a different entrance or to a different part of the building or whatever, to decrease the opportunities for spreading highly communicable diseases. You know, there's some other bugs out there now that are getting ready to turn up a lot. And so infectious diseases are going to be a thing, and some of them are highly contagious, and some of the new COVID variants are transmissible through the air, and so it's going to be a consideration. And so if you could identify those people via an app or telehealth and keep them from coming into the clinic unless it's absolutely necessary, would cut down the healthcare acquired infection rate significantly, I think. And that would be another selling point, just decreasing the amount of traffic and providing telehealth services to people who can be identified on the phone and don't need to see a doc if their symptoms are clear and they don't have underlying health conditions that will put them at risk. So just another idea for you. Further, next circle around on the bottom right of this mind map is on-site cafe and nutrition education. You're screening people for essentially nutritional deficiencies, and it's, to me, shocking that number of people who never had any nutrition education, apparently they missed health class. And so having videos in the office that are little 30-second clips of nutritional information would be a way to provide them with additional information while they're waiting, and it'd be an interruption to the trees and water, lakes and mountains videos that should be playing in the waiting rooms. And I have a connection who is a registered dietitian, smart girl, does a lot of TV, former nutrition specialist for the Dallas Cowboys team, and she would be a potential partner for you to generate content for these kind of 30-second nutritional commercials that could be playing in the waiting rooms while people are waiting to see a doc. Plus, the on-site cafe would be an opportunity for people to actually come in and get healthy food after their appointment or after they visit the health club, and learn how to eat and cook truly nutritional, healthy food. And so that's another kind of part of the focus on wellness, not on disease. Next circle says telehealth to decrease visits for minor diagnoses. I already talked about that a little bit, but telehealth is, viable as you saw in what I read. 7 or 8 hours a week for docs doing telehealth. That number could go up substantially if it was easy for people to make telehealth appointments, and especially if you screened out the depression and anxiety people, so the docs are only dealing with true physical illnesses. Then your docs could spend more time doing telehealth and less time doing inpatient services, which is going to be more convenient for your patients, members. I'm going to call them members or guests, and also more efficient for your docs. So just a thought. I think telehealth is underutilized in some ways, probably because docs are trained. They have to see a patient in order to be helpful, and I think the technology is going to allow them to collect some more health data remotely that they could use for some visits, not all, but for some visits that would decrease the number of visits to your clinic. To your health center. Let's see. Integrated pharmacy with a delivery. This goes along with the telehealth component, which is, if docs are diagnosing people and they actually needed some kind of medication, to be able to, call up an in-house pharmacy, which would allow you to another profit center, and then deliver the medication to the telehealth people at home, would prevent them from having to get in their car and go to a pharmacy just to get, the antibiotics for their, blah, 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 whatever it is. So having a pharmacy on site would allow you to do that, and like I said, would provide you with a potential profit center. I don't know about the regulatory issues there. There may be some, but anyway, it's an idea. Next circle around at about 2:00 is a senior living center adjacent. A lot of your patients are going to be us boomers who are having all kinds of health problems, and if you could find a location for this health center that's close to a senior living center, that's another built-in patient population for you, convenient for them, good for you, and it would allow you then to encourage those folks to use the health center because it's right here, and prevent a number of office visits for people who have chronic illnesses that are basically stress-related or not being well managed because they don't want to get out to get to the doc. So another thought. And the other, that's connected to my next bubble on top right at 1:00 or so on the mind map, which says daycare. I know from my experience that increasing numbers of primary care docs are women. That's primarily because, there's a male hierarchy. It's hard to break into the upper levels of, secondary care, tertiary care medicine if you're a woman. And so, women are more interested in kind of having a work-life balance. And so primary care docs at least can, go home at night. You don't have to get up to do surgeries at, the crack of dawn or before. And so, and for a lot of these women who want to be moms, one of their primary issues is daycare, because daycare is so stinking expensive that, if you're making $188,000 a year as a primary care doc and you're spending $30,000 a year for daycare for your 2 kids, that's a less than attractive career option. So an on-site daycare center would provide the docs with an opportunity to have someplace to put their kids and and it would also be a potential profit center, as you can offer once you have the space and the people, then you can offer daycare to people in the community. Another way to get people coming to the community health and wellness center for something other than being sick. So that's another pitch. Anyway, so that's kind of my brain dump on this whole issue. I got really excited after I talked to you about sort of the opportunity to use your startup as a way to really revolutionize primary care. And since you guys are you are obviously interested in wellness as well, and it's part of your business design right now, I'm just encouraging you to expand it, because this is a pitch for a big investor. This is not I mean, it certainly should be able to raise $10 million, but this is an opportunity to put together a model, make it work, make it profitable, and then replicate it 100 times. And because, as you know, quality healthcare is rare. A focus on health and wellness is revolutionary, and providing really good quality health care with this focus on health and wellness, as opposed to using the goofy, uncredentialed, docs out there who are pitching, all kinds of nutrient supplement crap, is a way for quality health care to be delivered in the context of a focus on wellness, as opposed to a focus on disease. And as you saw in my early part of my pitch, the system right now is really designed to treat diagnoses, not people. And this would be a way, and I really would advocate, that you stop calling people patients and just describe them as guests. And so the whole health and wellness center focus is a way to change the way people think about healthcare, and get them focused on being well as opposed to not sick. And so anyway, I look forward to your reactions to this, and we'll talk soon. Have a great day, and let me know what you think.